Hello friends, this time we have with us a world-renowned neurosurgeon, currently professor at Department of Neurosurgery, St. G.S. Medical College and KM Hospital and consultant at Leelavati Global and Nanavati Hospital. He has done fellowship in vascular neurosurgery at Barrow Neurological Institute, Phoenix, Arizona, US and endovascular neurosurgery fellowship at Fujita Health University, Nagoya, Japan. He has special interest in brain tumors and spinal surgery. So let's start our interview. Good morning, sir. Myself, Robert, co-chief editor of Gosumag 2020. Today I will be taking your interview. So, sir, first question: why did you make medicine your chosen field of study and career path? What aspects of medicine drew you to be a neurosurgeon?
So, just to introduce and add to the introduction, the speciality which I deal with of late is basically endovascular neurosurgery. And to highlight my main purpose of going into endovascular neurosurgery is stroke, which is the leading cause of disability in the world. Now, in our country, many people are facing this problem, so I specialize in this and I've started a state-of-the-art comprehensive neurovascular unit in neurosurgery department, which is the highlight of my passion and career. Having said so, the first question, as we all know, anybody, the aspiration who we follow is our parents. So my dad was a general practitioner, and obviously I was introduced to medicine and health treatment of patients by his career and his life. He was a very sincere and dedicated. He practiced for almost 50 years, and he stopped his practice, but now he's well hearty and doing very good in spite of being 84. So he is my hero and I follow him. So that's how I was inspired for medicine.
Would you like to share some anecdote from your UG medical college days?
Yeah. So from the beginning, as I was inspired, I was very sincere and dedicated student in my school days, undergraduate days, and during those times it was like when you were finishing the 12th, that is the 12th grades, it was on the merit of 12th you used to get the admissions. So I lost my BJ Medical College because I was studying in Pune by half mark. So my contemporary got the admission because there was some additional merit from extracurricular activities. That person got preference over me, though we had similar marks in academics. So that's how I lost my admission in there. And those days there was some 20% government quota, which was free in private medical college. So I joined and I got a call from Krishna Institute of Medical Science, Karad, and I finished my MBBS there. I did my post-graduation there, and it was all on merit. Though it was a private medical college, it was all on merit. So it was not a donation or otherwise course. And since then, the aspiration of becoming a postgraduate as well as a super specialist was the inspiration from Karad days. Now, anecdotal, what I would like to say is, being from a government setup and a mindset, I was a mix or was living there because it was a village sort of a thing. There was no other work except studies. So when I am practicing today, the message is very clear that your basics have to be very clear. So today, when I am treating brain patients or any patient, it is important to know that you treat the patient as a whole. So if you are studying in your MBBS, you are studying in your post-graduation, the most important key is you have to understand the human body as a whole. Even if you specialize, subspecialize into any of the subspecialties or super specialties, you have to manage the patient as a whole. It's not that only the brain is at a problem or one part and one organ is at a problem. So I always tell my students and my colleagues and whoever is doing medicine that the most important thing is your basics should be very clear, right from your anatomy, physiology, biochemistry and rest of the basic sciences. So don't ever neglect these subjects. You have your concrete, if your roots are very strong, you'll definitely grow well in life.
You trained under Professor Nerogo, father of a Japanese endovascular neurosurgery. How did this training contribute to your skill development?
So basically, Professor Niguro was the senior most neurosurgeon. He has now retired. I was fortunate in 2008 through one of our colleague neurosurgeons from Japan who introduced me to him. And with great difficulty, he accepted me as a fellow from outside country because it was only for Japanese people they used to give the fellowships for intervention. And luckily, the neurosurgeons all in Japan do endovascular neurosurgery, as against rest of the world like Europe and many other parts of the world, the radiologists do interventions. So here, the neuro intervention in Japan is done by neurosurgeons. So that was a good inspiration, looking way forward for me. And I joined them, they accepted me, and I was really fortunate to watch him do the interventions very skillfully. Secondly, the most important thing was the devices in Japan, they come at a little later date. Suppose there's a new invention, the Japanese authorities, FDA and all, are very strict in giving permission to the newer devices. So we used to work on the devices which are age old. Technologically advancements was there because Japan, you know, the imaging, the CT scan, the machines, the angiography suits were fantastic. So the technology was very good, but the devices were well tested and then utilized on the patient. So that added to my skills because on a previous what you call type of devices, not the advanced ones, we used to work, we used to treat patients, and it was really a most important part of my basics in neuro intervention, which made me today a very confident neuro endovascular neurosurgeon.
Your first operation as a neurosurgeon must be distinguished memory. Could you tell us more about that day?
Yeah, so it was like I remember in 2002 I joined this institute as a resident in neurosurgery, and once we it's the protocol is that in the second year of your neurosurgery you plan and treat the patients in the periphery of the hospital. That means the neurosurgery department has elective patients, means we do complex operations, while the trauma patients which are coming as an emergency, they are managed by the general surgery department. Now these general surgery department admit the patient, but the surgeries are done by our department, neurosurgery department. So it's the second year student or the second year what you call promoted person who will take that. Those times I remember 2004, 3 and 4, it was pager system. Those times mobiles were not there, so we used to have pagers. And I first did the call. I remember it was Sunday morning, and there were almost 26 calls, and out of that, I was supposed to operate 7 surgeries from morning till next day morning. So it was not the first surgery; it was multiple surgeries on the first day of my neurosurgery career, and it was really a tiring day because lots of calls, lots of serious patients to manage, and we were uh, exposed to them to manage these patients single-handedly. So I operated these patients down where there were lots of issues regarding the equipments and all because it's a general surgery theatre managed by neurosurgery for brain emergency. So we could handle those things. I upgraded some parts of the theatre there, like cauteries and all those things when I've experienced some difficulties, and also the drill system and all those things, which are basic things which we need to begin with as a basic surgery. So that's how it was. Like I remember still 7 surgeries per in the first day I had operated. For 24 hours I was just operating, and that was the a good experience because I love operating and treating patients and giving good results.
Regarding wide neck bifurcation aneurysm using newly FDA approved web device, what apprehensions did patient share for being first in the country? In what way did this operation impact your career and life at large?
I'm specialized as in neurosurgery, the endovascular neurosurgery that you can simulate is as a neuro interventions. Now these procedures are nothing but as we do angiography from the heart, I do it from the same thigh and go to the brain and treat problems. So initially these problems were treated by open surgeries. So majority of these vascular problems, like you have brain hemorrhage, you have strokes, you have some AVMs, then you have aneurysms, there are stentings, like we do for heart, I do it for brain. These were the pathologies which we treat in our updated lab which was installed in 2018 by Honorable Chief Minister Uddhavji. That time he was the President of Sena, and he came and we were fortunate that he inaugurated this unit and handed over to the public. Now, having said so, my passion is always to serve the poor and give them the best of the treatment, updated, latest, though they are not affording, because I have learned from them. It's my duty to really, I have become skillful because of I operated on these patients. So it's my duty to, I owe my skills to them. So whatever best I can do from the government, the BMC part, and treating and giving them the benefit of the latest technology, that's my goal. Now, how did this happen then? In 2019, we inaugurated this machine, 2018, sorry. 2019 June, I organized a national level conference in KM and at Haya. So this was organized by me and my colleagues in Mumbai. And it was a national level conference, and there were international delegates from all over the world who are pioneers in neurointervention. So one of the leading and the topmost interventionists called Jack Morey, he was kind enough to accept our invitation and to show some live surgery. So simultaneously during those times, this device was approved by Indian FDA, the web device. So he was happy to come and do some cases and demonstrate in our cath lab. So that he did, and obviously the poor patients were benefited because this device cost very high, some 9 lakh rupees, which was given free to these 3-4 patients which we operated. And this device is specially meant for complex aneurysm which are in bifurcation. Now bifurcation means the aneurysm have wide neck and there are normal vessels which are supplying the brain. Now this aneurysm is it's like a bomb which can rupture and cause life-threatening problems, brain hemorrhage, or it can be life-threatening. Now these aneurysms, to prevent them from rupture, we earlier used to coil those, leave a part of the neck and all, and the parent vessel has to be safe. It should not be having any problems, otherwise the patient will develop stroke. Now, having advancement in this device, so bifurcation aneurysms were always a challenging situation. So we have to preserve the normal vessel and occlude the aneurysm. That's the basic key. Having said so, this was the device which was introduced, FDA was approved, so he was kind enough to introduce in this. So we published this. It was in the newspaper and all over the news. It added definitely to the forte of our hospital, our center, our department, GS Medical College, because the world renowned pioneer who started neurointervention in the world came and did surgeries. And that's how it was really a fortunate, and it was a very memorable historical event for all of us in KM, and we did the conference very successfully. It was for 3 days, 1 day for live surgery and 2 days for academic discussion. And it was really knowledge sharing. The theme was techniques and technology, recent advances. That's how we introduced the new technology to the world, to our patients and the rest of the state also. So after that, we got a very huge applaud from limelight from our state and rest of the country for stroke center, because in public hospital there is hardly any stroke center which does novel treatment like on this angiography. When somebody has a blockage stroke, ischemic stroke, where there is a clot in the vessel and there is no distal flow, this ischemic stroke is more common than the hemorrhagic stroke. These strokes are treated at a particular time within a golden window period. If you open up the vessel and restart the circulation, patient can be saved from disability. So this was viral all over the country, state and world in fact, and we got lots of response from this patient. And the awareness of stroke, that timely treatment is very important. Now that golden window period for intervention for acute ischemic stroke is up to 24 hours. So if patients come to us within first 24 hours of large vessel strokes, large vessel blockages in the brain, we can go in on this machine and we remove the clot by a procedure called as mechanical thrombectomy, and that is benefited to the population at large, because nobody is doing these procedures outside, and in private it is very expensive. So that's how we introduced that mechanical thrombectomy, and that's become very, very popular, and we have treated almost 700 patients since the introduction of this technology and availability of this machine.
How has introduction of a biplane DAC neuro machine in Advanced Stroke Center in KM Hospital has impacted lives of a patient suffering from stroke?
I think that this introduction and availability of this biplane. So the important thing is time. time is brain, what we say. And acute ischemic stroke, as I just mentioned, it's a stroke where there is blockage or a clot or a thrombus in an artery, and distally there is no circulation to the brain, and the brain starts dying. The brain cells start dying, and there is usually brain do not survive without oxygen as well as blood. So having said so, this is the problem which can cause lifetime disability, and that's how we can give treatment in time. That's our mission. That's our center's what we call forte, that we are doing treatment for all these patients. Even at night, if there is patient, I come and do this thrombectomies and all. And we have a team which is working very hard to treat this patient who come in golden window period. Now, just to introduce and just to elaborate a little bit, what is an acute ischemic stroke and why this time is important. So the current guidelines in 2018, the American Stroke Association and Heart Association have given some guidelines after some trials, and these two trials, like down and diffuse trials, which are very important, which decide the time period of treatment. So a person who develops symptoms of acute ischemic stroke like paralysis, facial asymmetry, one-sided weakness, and speech disturbances, what we call face, arm and speech, this triad, if it is there and somebody develops these symptoms, immediately they have to rush to a center which is stroke ready, which has MRI or CT scan, and which has facility to give injection within the first 4.5 hours. That is a thrombolysis injection if there is a blockage stroke, and then intervention, as we have introduced and made it available for all the poor and every strata of our society, that we can do intervention, do the mechanical thrombectomy procedure, remove the thrombus mechanically by doing an angiography on our newly introduced bioplane lab, and give benefits within time. So if we do in time, the patient can become normal. Otherwise, they are left with disability for lifetime. So this is the golden window period. I always request and give a message to the society, everybody, the healthcare workers, that please, if you see such patients within time, that from the onset of symptoms, we should refer this patient to our center so that they are given.
How is your specialty endovascular approach different from the traditional neurosurgery?
So, as we know, brain is the supreme in our body. It is a very supreme organ. It has memory, speech, and the control whole of body. Having said so, the technological development in the traditional neurosurgery, for example, vascular neurosurgery, which I am dealing with of late, is earlier we used to do clipping for difficult aneurysm, complex aneurysm, and the clipping technology has not significantly modified or advanced as compared to the other technology of intervention. So today we talk of surgery, minimally invasive surgery. We don't want maximum invasive. That means we do a craniotomy, go in, do a clipping, and there are lots of side effects. There are lots of issues. The morbidity is high when we do an open operation. Similarly, when we see parallelly the advances in endovascular neurosurgery, there is lots of advances every day happening. So these tools, which are rapidly developing, gives us better results, better outcomes, and less mortality and morbidity. So they are more safer. I would not criticize clipping as such or open operation or traditional, because we have learned, I do that even today in select patients where it is indicated. But the preference goes to the technological advances because patients demand nowadays. Because of the awareness of on the net, they are aware of what is intervention, what is coiling and clipping. They always prefer that. They don't want an open operation. Without operation, from angiography, from the thigh or the groin, we go and do this procedure. There's no scar, there's no invasion, and these techniques, new technological tools which are available, we make use of them and do a good operation. Same problems are dealt with with this new technology, which is always better, and people also prefer it. So minimally invasive is what is the key today, and that's how the traditional values of open surgery is a little going on, especially when we are talking of intervention or vascular neurosurgery.
How did you react to highly stressful situations or deal effectively with personal stress in your job as a doctor?
Is especially in the neurosciences, it's a challenging job. Outcomes are very, very important depending on your skills. So everybody is watching your results. So there's always a professional stress. Having said so, you have to balance, but this is a very demanding field. Your time is very, very important. You need to really dedicate yourself, your life to this neuroscience, because as we know, brain is a complex organ. and we need really a complex approach to every patient. So you have to give time, you have to be dedicated. Only the skills is not important, but post-operative care, all these small things, rehabilitation, everything does matter. So it's a holistic approach which is very, very important. You have to have a good team, you have to have a good support from the hospital, institute, from the infrastructure, and that additionally is an important task to deal with, especially in a high volume center and especially in a public hospital. So that stress you have to combat, you have to overcome, and you have to do more better job than you do in private, because the other factors are not in your control. Having said so, you do a good job, good surgery. If there is no good post-operative care, your results are compromised. So we don't want to happen that. That's how our stress is there. So because we are stressed, we are bothered, we are caring about this patient, we have additional stress on this, and we have to deal with it. We learn with it. We learn with our day-to-day exposure, and we combat it. Having said so, my way of handling stress is I always keep a balance between my physical fitness, doing some exercises, yoga, meditation, and that's how you can really overcome the stress. So you have to balance your life, dedicate yourself to the neurosciences, your profession. That's the first thing. But parallelly, you have to have time for yourself. Otherwise, it's difficult to manage stress, and then it can affect your results.
If not neurosurgery, what would have been your field of expertise today?
Yeah, so frankly speaking, I think so. As I had said in the beginning, I was always inclined to become a doctor because of my father's inspiration, and I never thought of having a parallel field. Now, I said in the beginning that I lost my admission because of 1 mark for my MBBS in BJ in a government hospital. So that time, those days, I had to keep all science as well as engineering options. So luckily, or unfortunately or fortunately, I would say, I got more marks in the engineering side. So I got an admission in the best seat in College of Engineering Pune. That those days computer science was the top. So I was first in that, and I took admission. But I was never happy going with the flow engineering because that was never my forte. So after 2 months, I got a call from my Karat institute as a what you call the 20% government quota. I joined there late as a regular thing, and I left engineering, and that's how medicine and being into health was my always a dream.
What will be your advice for medical students in our college and aspiring neurosurgeon?
To look forward as students, my uh, humble and sincere advice would be: see, today's world, there is lots of technological and internet access, which is giving you lots of information. That has a little bit drifted our approach towards impractical way. For example, the expertise and experience when you're dealing with a patient, it has to be, you have to have a real time experience. So when you're studying from your first MBBS, second MBBS, third year, when you go towards the clinical side of that, don't neglect your clinical expertise. Don't neglect your clinical acumen, examination of the patient, history taking, and all those things. It cannot be, I'm sure medicine cannot be learned from sitting at home and in libraries. It has to be with the patients. So we all should get ourselves exposed to the patient. Learn from the patient. Every patient is a teacher, and don't substitute it with artificial intelligence or sitting it with a laptop or the technology. It is not going to be the future. So learning from the patients, that's my message. You have to treat the patients practically, learn from the patients when you are studying, and be sincere, be dedicated. Don't have shortcuts in life while you are, because it's a human life. We are dealing with humans. There is no much margin for error. So if you have your good basics, you have a good approach, if you are dedicated, sincere, there is no, you should not leave much scope for errors. And that's how you will succeed. And that's the way your approach should be. And that's my message to the students. For aspiring neurosurgeons, definitely, as I said, it's a very challenging subject. It's a dedicated life. It's a very hard working. You have to give too much time. You have to compromise on your personal life many a times. But if you're willing to do that, you should go ahead and do this field sincerely. And if you are hardworking, sincere, definitely you will flourish in the life.
you, sir.
So your journey has been truly inspiring.
Thank you, sir, for the interview and giving us your time from your busy schedule.